Hi, this lesson covers chapter 15 from the Healthy Living text. This chapter is on aging, dying, and death. So just like some of the other topics that we've previously covered, these can be a little bit tough to talk about as we talk about getting older, death, loss of loved ones. So we will talk about all that in this chapter. So just some terms. Aging is defined as the sum of all changes that occur to an organism during its life. Lifespan is the maximum number of years that members of a species can expect to live when conditions are optimal. So for us, very few people live past 105 years. That's pretty much the longest lifespan we can expect. Senescence is another word for older adulthood, and it's the stage of life that typically begins at age 65, ends with death. We usually need some number to put on when someone is considered to be old or elderly, and for most intents and purposes, 65 seems to be that magic number. Life expectancy is a little bit different than lifespan. That's the average number of years that an individual born in a particular year can expect to live. So as we've seen medical advances and things like that, life expectancy has typically gone up as people are born later and later. So in 2014, the average life expectancy was about 78.9 years. Women do tend to outlive men by about 5 years, and Americans can expect to live about 67 years or so in good health. So some of the characteristics of aged Americans, the majority of people over the age of 65 own their own homes or live with family members. They are generally able to take care of themselves. The oldest of the old, who they consider anyone over the age of 85, they're more likely to be severely disabled and poorer socioeconomically than the young old, who are 65 to 74 years old. Middle old is your 75 to 84-year-old range. Most older adults are independent and financially secure. Fewer live in poverty now than did in the 1960s. Elderly members of certain minority groups like African Americans and Latinos are more likely to have lower retirement incomes and live in poverty than elderly white people. And so some things that we have to keep in mind with older Americans is the high cost of health care becomes a major concern. Most people get their health insurance through their employers, and when older people retire, they're no longer employed, they don't get health insurance that way. And even though they do get Medicare, Medicare doesn't cover everything. So they do have a lot of costs associated with seeing doctors and getting prescriptions, which as we age, we tend to do a lot more often. So why do we age? Genetics, environment, lifestyle, all influence the aging process. Scientifically or physiologically, cells have a limited number of cell divisions. So as people age, we're not producing new cells, cells aren't dividing as quickly as they did, and so we tend to show the signs of aging. There may be some genetic material on the chromosomes that are somewhat biological clocks that actually sort of age out cells, and once they get to a certain number of divisions or a certain age, they do start to die off. Damage to genes, your chromosomes, your genetic material, due to radiation, pollution, drugs, viruses, anything like that can cause damage to your cells, and they can then stop making proteins, stop reproducing, stop growing the way that they should. Faulty proteins can sort of speed up cellular death. So again, exposure to these known triggers may speed up the aging process as well. So physical health and how aging relates to physical health. This actually really surprised me that people begin to experience a gradual decline in function after the age of 30. I don't know, I don't think 30 is all that old, but I suppose that's true. So some normal signs of aging include things like menopause in women, delayed sexual responsiveness, graying and thinning hair, loss of height, you do actually tend to shrink a little bit as you get older. What happens is actually the discs between your vertebrae start to lose some of their elasticity and your spine does shrink a little bit. Presbyopia is the medical term for nearsightedness. So it's the inability to see objects clearly, often needing reading glasses and things like that. Some other things that happen as we age, or could happen as we age, are age-related macular degeneration. This is a disorder of the eye that results in distorted and blurry vision, and it can lead to irreversible blindness. Smoking and family history increase the risk of macular degeneration. Cataracts are clouding of the lens part of the eye. The lens is the clear or transparent coating on top of the eye, and if it becomes cloudy, it will reduce vision. So wearing sunglasses to shield the eyes from ultraviolet light may help to reduce the risk of developing cataracts later on. Glaucoma is another visual change. This is abnormal fluid accumulation in the eyeball, which can cause vision loss. It puts pressure on the optic nerve, which is located at the back of the eye. And so if you've ever had an eye exam and they've done that test where they put a puff of air in your eye, that's what they're testing for. They're testing for the pressures in your eyes to make sure that you're not at risk of developing glaucoma. Osteoarthritis is a normal wear and tear on the joints of the body. So it's a group of diseases. It does involve inflammation of the joints. It is very common in people over the age of 65. The most common joints we see osteoarthritis form is in the hips and the knees because they're weight-bearing joints. We can also see it in the spine and the shoulders. And then urinary incontinence is something that we see a little bit more often in the older population. And this is, for whatever reason, an inability to control the urine. There's actually a couple different types of incontinence. There's urge incontinence, where you feel like you have to go a lot, even if you don't really have to. And there are a lot of medications out on the market to help with this. You've probably seen some commercials on TV for it. There is stress incontinence, like when you sneeze or cough or jump, it causes a little bit of urine to leak, and that's more of a muscular weakness issue. And then there's also another kind called functional incontinence, and it's really no issues with the bladder or the urinary system itself, but it's just because old people have a harder time getting around. They might not be able to get up and get themselves to the bathroom in time, and then they have an accident. Alzheimer's disease is something we also sometimes see in the elderly population. This is not a normal part of the aging process. Alzheimer's disease is a pathological condition. It is characterized by memory loss, confusion, and potential loss of control over behavior and body functions. It is a progressive condition. There is no cure currently for Alzheimer's disease. They don't really know what causes it either, although they do think there may be a genetic link to at least some forms of the disease. And there is some imaging now that can detect shrinkage of the brain, which is a sign of Alzheimer's disease. As of 2015, Alzheimer's was the 6th leading cause of deaths in Americans. Some other things that can have an effect on psychological health as we age. One is retirement. A lot of people really look forward to retirement, the day they don't have to go to work anymore. But for some, it can actually cause a lot of stress. When you retire and you no longer get up and go to work every day, it's kind of a loss of your life role. And some people have a very hard time dealing with that psychologically. It can absolutely be a concern about loss of income. So if things weren't planned out financially ahead of time, some people may not be able to retire or will really worry in retirement. How are they going to keep up with the cost of living? So some people do choose to continue working even into older age. Some will find new interests to stay busy, to stay productive. They find a new hobby. Some get another job. I know lots of retired people who maybe retired from one job and went and found another job, maybe found something that they really enjoy doing at that stage in their life. So again, planning for retirement while you're young, and this is something that everyone should probably start thinking about as soon as you start working regularly, will help to build some of that financial security later on in life. Some other effects of psychological health: poor health conditions. As we age, we tend to, not be as healthy. We develop more age-related conditions. We tend to be more sedentary. Isolation, you might not be able to get out and about as much as you did before. And then death of friends and family members. So all the people around you are starting to age as well. And so your spouse may die, your best friend may die, your siblings may start to die. And so the people around you are dying, and you see it a lot more often. And that can be very hard to deal with psychologically. So staying physically and socially active can help to combat some of these psychological issues. And in severe cases, medication like antidepressants and psychotherapy may be necessary because we have seen increasing rates of suicide in the older population. So social health and how aging affects that. Ageism is a negative bias towards the elderly. It can result in mistrust and conflict between generations. So just even little things like showing appreciation and respect can help combat ageism. Elderly Americans can be a valuable social asset, and they can be experienced consultants or advisors, so they can share a lot of their experiences with us if we talk to them and listen. So successful aging, right? So people who age successfully are still independent. I know that's a really, really big deal, and it's something I don't think we really think about when we're younger. We kind of take it for granted. But I remember that as my grandmother got older and older, that was one of her biggest fears, was that she was no longer going to be able to live on her own in her own house. So we want them to try to stay socially active, keeping a group of friends, family, anyone that they can socially interact with so they're not so isolated or don't feel so isolated at home, and try to remain in as good of health as they possibly can. Physically active people do tend to live longer than those who are sedentary, and we've talked about this through a lot of the other chapters that we've covered so far. And having a positive outlook, maintaining good spiritual health, and engaging in social activities can also enhance successful aging. So dying. Dying was very different 100 years ago. Times have changed a lot. Medical advancements we have now can keep people alive for a lot longer and keep people healthier for longer as well. So that's kind of the physical part. Spiritually, some of those aspects of dying, a person's culture and religious backgrounds sort of help provide a foundation for how someone feels about death and, potentially life after death. And people who believe in an afterlife may have less fear of dying and death. So someone's culture and someone's religion can really sort of shape the way they feel about death and dying. Some of the emotional aspects of death, family, healthcare providers can help enhance dignity and self-worth of someone who is going through the dying process. And as the end of life nears, the ill person may become more detached. They may start to sleep more, slip in and out of consciousness. And here are Kubler-Ross's stages of emotional responses to dying. And this is for the person who is dying, right? So the stages are denial, thinking this isn't really happening, anger, lashing out towards the doctors, loved ones, bargaining, trying to make deals, depression, and then finally acceptance. So caring for those who are dying, one part of terminal care is what we call hospice. It's specialized care for patients who generally have a limited amount of time, usually a few months left to live. So it's designed to give emotional support, and pain relief to terminally ill people. Usually they come into your home, or it can be provided at a special center as well. But hospice care isn't trying to cure the disease that the ill person has. It's basically just trying to keep them as comfortable as possible knowing that the end is near. Hospice also provides support for family members and grief counseling for survivors. Currently, the majority of Americans die either in a hospital or in a nursing home. Signs that death has occurred and reasons that we can consider someone dead is that the heart or lungs stop functioning. Once the brain goes without oxygen for even a couple of minutes, it will start to die. When there's no electrical activity in the brain, no spontaneous muscle movements, the bladder and large intestine eliminate their contents, the reflexes are absent, so we can't elicit any movement. The body will cool to match the environmental temperature, and then decomposition starts to occur. An autopsy is the medical procedure that's used to determine the cause of death. We will talk a little bit about brain death or in the next slide or two. But sometimes what can happen is there can be a lot of damage done to the cerebral part of the brain, which is the large, sort of more external part of the brain, and that's the thinking part of the brain. So that's usually when they say that the person is brain dead, but they can still be functioning because the inner part of the brain, which is very well protected, the brain stem, is what controls our heartbeat and our breathing. So some of the vital functions of our body may still be able to be completed, or the brain keeps those functioning. However, the person is still brain dead in that they will not sort of come out of the coma. They will not be responsive again. And there are tests that can be used to determine this. And this is what's also called that persistent vegetative state. So that sort of ties into a little bit with euthanasia and the right to die. So this is the practice of allowing permanently comatose or incurably ill people to die. So there's active euthanasia and passive euthanasia. Some states have passed laws that allow for some or one of type or both types. Active euthanasia is often called physician-assisted suicide, and this is where the physician will help the person with death by either overdosing pain-relieving drugs that will stop their breathing, stop their heart, or there's passive euthanasia where physicians don't provide life-sustaining treatments or withdraw such care, such as turning off the breathing machines that were keeping the person alive. Physician-assisted suicide is legal in a few states. Oregon, Colorado, Washington, California, Vermont, and Washington, D.C. Those are the only states that allow for physician-assisted suicide. It is illegal in every other state. So when we talk about preparing for death, we may want to consider preparing what we call advanced directives that indicate your wishes if you would ever become incapacitated. So these are things such as use of life support, breathing machines, ventilators, feeding tubes, things like that. Whether or not someone wants to be considered DNR, which is do not resuscitate, so that if they do go into a sudden cardiac arrest, you won't perform CPR or try to sort of bring them back. Also wishes with things like organ donation, whether or not you wish to be an organ donor. At the very least, discuss your wishes with your family so that your family members and your close relatives, they know what you want. Ideally, get it down in writing. Durable power of attorney document is going to specify your wishes and identifies someone to make decisions for you, again, should you become incapacitated. This would be your healthcare proxy, and again, they will make decisions should anything happen to you. So you would name that person in the durable power of attorney document, or your will is what we usually refer to it. So here are some things that we can again think about as we sort of prepare for death and dying. Again, advanced directives. What should happen to you? What kind of measures do you want taken in order to sustain life? A living will. This is where you want your assets to go. If you have any life insurance, children, any estate, own a home, all the contents, those types of things. The executor is the person who will manage your estate after you die. Again, we mentioned organ donation, but again, to think about that, indicate that. I know you can put it on your driver's license, but let your family members know as well if that is something that you want to do. And funeral arrangements. I know a lot of people, as they get older, they actually start to sort of plan or save for their funeral because they can be very expensive, and they don't want to put that burden on family members. Grief is the emotional state or the emotions that someone goes through when they lose someone special or beloved. Bereavement is a process of resolving that grief, and mourning is a culturally defined way which we display grief. So crying, wearing somber clothing, or different traditions that we might do following the death of a loved one. There are sort of normal and abnormal signs of grieving. Obviously, when you lose a loved one, it is going to be difficult to deal with. But some things that might be signs of abnormal grieving, where someone might do better if they talk to a mental health professional. Here's a list. You guys can kind of look through that. But outbursts of anger, feeling or finding no pleasure in life, suicidal thoughts, thinking about the deceased loved one a lot, having hostile or guilty feelings, significant weight loss, weight gain, or insomnia, the inability to sleep, starting to engage in risky behaviors, and lacking personal hygiene for more than 2 weeks. So again, if you notice these signs in someone, it might be worth trying to get them to talk to someone professional. So children's response to dying and death, with preschool age children or younger age children, they will certainly miss the person who has died, but they don't express grief in the same way that older children and adults do. Some of it is, I think, they maybe don't completely understand the finality of all of it. They may act indifferent, or they may become intensely involved in play activities. They may misbehave, so they may act out as well. Older children usually associate death with being old, and so they may have a lot of difficulty trying to cope when a peer or someone younger dies. That's a little bit harder for them to process. So all children are going to respond to death a little bit differently, and professional counseling may be needed if the child does start to misbehave or act out. So that's it. If you guys have any questions, please let me know.